So you want to know, should I have health insurance? Well, this video is all about whether or not you should have health insurance and alternatives to health insurance. Welcome to Health Drama. I'm Dr. Bert Vorstman, a urological surgeon and former researcher, and this channel is all about routine medical conditions, self-care, and digital health, so you can be informed and in control of your healthcare needs. By the way, if this is your first time on the channel and you like fact-based healthcare details and not fiction, go ahead and subscribe below. By the way, Health Drama is for educational and informational purposes only and not a substitute for professional medical advice. The links to this disclaimer and the material in this video are in the description below. Okay, so let's get into it. This video, should I have health insurance, and sort fact from fiction. So the health insurance industry makes many marketing claims, but remember, health insurance is financially driven and plagued with scare tactics and exaggerations. So each year prior to the made-up enrollment period, you get bombarded with endless claims about the many benefits of health insurance, that it controls healthcare costs, keeps you healthy, prevents medical debt, gets you annual checkups and screening services, and that health insurance coverage gives you peace of mind. Well, let's drill down a bit on all these claims about benefits and sort fact from fiction. So the facts about health insurance are that it's failed to control costs, failed to improve overall health. Just look at the ballooning obesity and cancer rates. It's failed to prevent medical debt, as you can go into medical debt with or without health insurance. As well, most annual checkups and screening services fail to save significant numbers of lives. And health insurance has simply created numerous barriers to the access of routine care. In fact, not only does the health insurance industry control the narrative about health insurance benefit, but it controls virtually all healthcare pricing, healthcare access, and healthcare delivery. In the process, health insurances have made access to routine healthcare highly inconvenient, inefficient, and expensive. Again, the links to the material in this video are in the description below. So what does health coverage by an insurance plan really mean? Health coverage is really a play upon words. The reality of health insurance coverage is that not only do you pay for costly health premiums, but you also pay for copays, deductibles, non-covered services, out-of-network services, and rations care so that you don't use more services than the plan thinks you need. Because of these many insurance-based rules to routine healthcare access, most people pay more for health insurance premiums than they ever use in services. As well, most people never meet their deductible. This means that many people are paying for all or part of their routine care. So in addition to the many costs handed to patients despite their coverage, let's look at some of the other pain points that health insurances puts in place. So in addition to the many costs associated with insurance-based healthcare, patients are burdened by many other insurance-based pain points. Insurance contracts are complex, confusing, and loaded with rules and barriers. Also, insurance plans lump healthcare consumers into risk pools so that those making good lifestyle choices are helping pay for the premiums of those not making good lifestyle choices. For example, Big Pharma is lobbying the health insurance industry now to cover the drugs used to treat obesity. This means that non-obese people's premiums will rise to help pay for the expensive drugs to treat obese people. And in addition to having to navigate all the complex insurance-based rules, patients are burdened by barriers to healthcare access with the likes of referrals, authorizations, delays, denials, rationing of care, opaque pricing, and surprise bills. As well, there's the problem of changing provider networks, with doctors leaving certain plans and network restrictions. Incredibly, all of these many insurance-based barriers are in place for just trying to visit a doctor. And by the way, because the health insurance industry controls virtually all pricing, access, and delivery, there are no market forces, and value-based healthcare is just a myth. So how much healthcare does a typical patient use or access in any given year? So on average, a patient visits the doctor some 2 to 3 times a year, and a lot of younger people never visit the doctor. The average urgent care visit cost is about $150, so 3 visits is about $450. However, the average premium for a single person is about $7,000, meaning that most single people are overinsured by at least about $6,500. This breakdown of patient healthcare usage versus healthcare premium costs exposes a major problem with the health insurance industry's unnecessary control of routine office-based and outpatient care. So why is the health insurance industry covering routine office expenses when virtually no other insurance business covers routine expenses? For example, your car insurance doesn't cover the cost of a new tire. So the rationale or purpose of having insurance is to protect against significant unanticipated economic losses, such as from major medical needs, not to cover routine expenses. Aside from healthcare, most insurances do not cover routine expenses. And 80 to 90% of all the healthcare delivered is generally affordable routine office-based and outpatient care. By letting the health insurance industry cover routine care services, people are subjected to their rules, barriers, inefficiencies, inconveniences, and expenses. This problem with coverage of routine office-based and outpatient care has been identified as the root cause of our broken and unsustainable healthcare system. Because of this, there are no market forces in healthcare. On the other hand, where we do see market forces in healthcare and stabilization of costs is in those sectors like infertility, weight loss, and cosmetic surgery, where insurances and the government are typically absent. So what sort of insurance is typically reasonable for most people? So should you have health insurance? Yes, you should have health insurance for major medical needs, not for routine office-based services. You should get health insurance with the biggest deductible that you can live with and pay for your routine office-based healthcare expenses. This way you can stop being overinsured. Why is it that most people pay more for their health premiums than they use in services, and most people never meet their deductible? So if you want to be in control of your routine healthcare needs and expenses and not overpay, get health insurance with the biggest deductible you can tolerate and pay for routine expenses. So there are some groups looking at alternatives to insurance-based coverage of routine expenses. Let's check these out. Several groups are looking at providing alternatives to conventional health insurance plans for routine office-based and outpatient care. This kind of care represents 80 to 90% of all the healthcare services delivered. These various groups include direct pay organizations for primary care physicians, then there's telehealth or telemedicine, online drugstores, and other direct pay organizations such as UberDoc, Sesame Care, MDSave, GoodRx, as well as others like Apple and Amazon and Christian Health Ministries. Some groups are also looking at digital health marketplaces as a way of making routine office-based and outpatient care much more convenient, efficient, and affordable. And again, it's perfectly legal to pay cash for healthcare services whether or not you're covered by an insurance plan. Almost every industry has an online book and pay system. Since 80 to 90% of all healthcare services are generally affordable, routine, office-based, or outpatient, let's see if these services can be put onto a digital health marketplace. So the digital health marketplace has many benefits. It can feature 80 to 90% of all the healthcare services delivered. This means all routine office-based or outpatient care, and it can be put on a platform and accessed by an easy book and pay system. Such a platform avoids unresponsive scheduling staff, eliminates barriers to access such as referrals, delays, denials, rationing, and surprise bills. The platform is cost transparent, affordable, convenient, fast, and highly efficient. There's no good reason why patients should let insurance companies control their routine office-based and outpatient healthcare needs. Health plans should not be deciding who you can see, what you can have, and how often you can have it, especially for routine office-based care. With a digital platform, you're in the driver's seat, not middleman, and you control 80 to 90% of all the healthcare services you will ever need. So let's look at an example of a digital health marketplace platform. I'll show you some screenshots of both web-based and mobile, but mostly mobile screenshots. So it's relatively easy to list the generally affordable routine office-based or outpatient healthcare services for all physicians and specialties and eliminate all the artificial rules and barriers associated with insurance-based care. Routine services, again, represent 80 to 90% of all the healthcare services delivered. So this is a fairly standard website layout with a header, body, and footer sections. The header features the logo and menu that includes how it works and areas for patients, employers, and providers, as well as a blog section and profile section. In the body, you find the search bar where you can find doctors, providers, and routine office-based and outpatient tests and treatments, and a footer section that contains information about legal, about sitemap, contact, social proof, and so on. And to use it, you simply follow the navigation flow as for any other book and pay platform. A digital health platform eliminates all the barriers, restrictions, delays, denials, opaque pricing, and surprise bills that are associated with insurance-based care. There's a search bar for you to find the doctor, test, or treatment you need for routine office-based and outpatient care. On a digital health platform, you're in total control of your routine healthcare needs, and you go to your insurance plan for major medical needs. So what can you expect from your visit that you made on a digital health platform? So after making the appointment on the digital health platform, you only need to provide ID and some personal details about your visit. There is no need to provide insurance details, even if you have insurance. As well, you don't pay co-pays, and you avoid provider network restrictions, and you can see who you want. And your healthcare needs won't be rationed by some faceless middleman. And if you need to schedule additional visits and tests, you can schedule them on the platform even while still in the doctor's office. Remember, it's perfectly legal to pay cash for healthcare services whether or not you have health insurance. So to recap, most people pay more for health premiums than they ever use in services. Most people never meet their deductibles. Cash pay for healthcare, despite having insurance plan coverage, is perfectly legal, and 80 to 90% of all the healthcare services delivered in the U.S. are generally affordable, routine, office-based, or outpatient services. To learn more about routine medical conditions, self-care, and digital healthcare, check out these other videos.